It's a syndrome that occurs after a patient may have an injury. It might be a sprain, it may be a fall, it may be surgery that causes them to have extreme pain associated with swelling in their extremities. It may be associated with color changes in their extremities. It may be associated with sweating. But it leads to a significant amount of pain and a fair amount of distress to the patients because they're trying to reconcile what's going on with their bodies after what they believe to be a simple injury or surgery. There's a lot of different presentations in patients with complex regional pain syndrome, mainly because there's a lot of different possibilities or etiologies for complex regional pain syndrome. The thing to recognize is to try and use the diagnostic criteria that have been set forth by certain committees that have really set forth what we believe to be probably the best diagnostic criteria that encompasses most of the patients with complex regional pain syndrome. So again, what we're looking for are changes in color, changes in the temperature of their extremity, and most importantly actually is pain out of proportion to the inciting event. If they only have pain out of proportion, or if they only have allodynia or hyperalgesia, then that's neuropathic pain, but it's not necessarily CRPS. There's a lot of different types of neuropathic pain. The approaches that we need to use for patients with complex regional pain syndrome are to use pretty much every tool in our tool belt. We want to make sure that we use psychological coping strategies. We want to make sure we use medications effectively. So maybe we want to use medications that are more aimed towards nerve pain. Maybe we might want to use interventions like sympathetic nerve blocks. If cases that are really bad, we might want to use modalities like spinal cord stimulation. But the most important thing, again, we want to use all those things together to get the patient to do meaningful physical therapy, functional restoration, and desensitization therapy. The interdisciplinary model is important because it also offers a lot of different, make sure that we're all on the right track. So we're kind of reaffirming that we have the correct diagnosis and that we work together as a team. Everyone has their skill set and we work together as a team to really help our patients the best way possible. We're going to employ a psychologist, an interventionist. We're going to involve our primary care doctor to make sure the medications are being effectively managed, potentially even the surgeon to make sure that there's nothing else that we need to do surgically to make sure that there's no other post-operative complications.
Possibility that in that kind of area you could have such symptoms?
Yeah, so again, we want to make sure that we can remobilize this limb that is extremely painful to move, that has color changes, sweating change, all these different changes that occur in the limbs. So again, over time what we've seen in patients with CRPS is that their limb becomes immobilized and they don't move it purposefully because of all the pain. So we have seen that over time when we can remobilize that limb, that their pain actually improves as well. So initially it's thought it is painful for them to move, but we know that over time if we remobilize and get them to be more functional in that limb, that their pain decreases. The main thing is early diagnosis, to recognize that after 2 months, after a surgery, after a fall, if they're continuing to complain of symptoms that may seem odd and signs that may seem odd, that to at least understand or recognize that that may be complex regional pain syndrome and that they may benefit from an early referral to a specialty pain clinic or a neurologist to help you with that diagnosis, to confirm that diagnosis. Because again, we want to use a team approach to really ensure that that is what we're treating. If we can use that diagnostic criteria to help diagnose those patients early, or at least recognize those patients early, I do think we can have a significant impact for their quality of life.